The HCF Research Foundation was established in 2000 with the aim of finding real-world solutions to improve patient outcomes and drive positive change in the healthcare system for the benefit of all Australians. Since then, we've become Australia's largest non-government funder of health services research. Health services research is all about the health system itself and about how patients experience that health system. So it's about how they access it, how the health service is delivered, and how they respond to that in terms of outcomes. And it's also about the equity of care, so patients are experiencing and receiving the healthcare at the right place, the right time for their particular condition.
One of our early research programs funded by HCF was looking at inpatient rehabilitation after knee replacement surgery. We showed that simply by avoiding the inpatient stay after a total knee replacement to have rehabilitation, we could save $7,000 on every knee replacement procedure that was done, and that's more than the cost of the knee replacement itself. The funding that we've received from the grants has not only enabled us to do single projects, but it's enabled us to train other researchers, and those projects have led to further projects. And the whole idea of our research is to improve patient outcomes, to improve the health of the population, and we wouldn't have been able to do that without the initial funding from HCF.
The back-at-home model of care for back pain only came to life because of support from HCF Research Foundation. The grant came at a pivotal moment back in early 2020 as COVID-19 was emerging and Silmako Health District was launching Australia's first virtual hospital, RPA Virtual, which allowed us to partner with them and translate our research into frontline care. Our back-at-home model of care was successful in reducing ED representations by 41%. And across our hospitals, we saw a drop in admissions by 28%. Funding from HCF Research Foundation has allowed us to innovate, and with innovation, we can provide better care to our patients and improve health outcomes for all Australians.
Our projects span areas where there are opportunities for significant improvements in the healthcare system. And that includes things like mental health care, rural health care, aged care, and many other chronic diseases that patients can experience, and sometimes all of those things together. These funded projects lead to evidence-based innovations that directly benefit patients and the healthcare system.
One of the things that I love most about working with the HCF Research Foundation is that it really affords clinician researchers like me the opportunity to apply for a scheme that is all about implementing evidence and changing practice on the front line. But what's even more important is that knowing there's this scheme for future clinician researchers who see what's going on at the coalface every day and are really aware of what is needed to make care safer and better for patients. Working with the HCF Research Foundation has enabled us to generate really good quality local evidence so that it can be upscaled to other hospitals and other areas, and actually across most of Australia.
As Australia's largest not-for-profit health fund, we have the opportunity and the responsibility to drive positive change across our healthcare system. Through our research foundation, we're investing in innovative research teams addressing real-world health challenges. We're not just talking about a better standard of healthcare, we're actively working in partnership to achieve it. At HCF, our vision is clear. We want to improve healthcare access and outcomes, not just for our 2 million members, but for all Australians. The HCF Research Foundation is central to achieving that vision. We're committed to staying at the forefront of defining innovative, tangible solutions to the emerging health challenges in this country. Whether it's developing new care models for our ageing population, leveraging technology to reach underserved communities, or finding ways to deliver high-quality, high-value healthcare more efficiently, our focus is clear: to drive better healthcare access and outcomes for the benefit of our members and all Australians.